The training video that we've produced in order for you to learn and use the crane ultrasound machine on the neonatal unit here at Singleton. It produces very good images, but it takes a little bit of getting used to, and hopefully this video will help you if you're not familiar with the machine. Okay, in order to perform a crane ultrasound scan, you'll first need to know your way around the machine and how to switch it on and where the controls are. So the first video is to show you how to do that and get ready for performing the crane ultrasound scan. So the power lead is at the back of the machine, and the first thing I'm going to do is plug it in. And you'll see the little light comes on to show that the machine is receiving power. There is a chance that the machine's trip switch might also go off, and the trip switch is down here just behind the front caster, and if by any chance that does go off, then you can put it on by lifting it up. On, you press this button at the top left corner of the touchscreen. You'll hear the machine boot up. The machine takes about a minute to boot up, so I'll use that opportunity to show you around the machine. So this is the high definition screen where the images are portrayed, and it's held in place by an arm which you can move around, so you can unlock the little locking device there, and you can move the arm around to get it into the place where it's most convenient for you. When you're moving the machine around, it's probably best to lock it there. Beneath the main screen we have a touch screen which enables you to control some of the functions of the machine by touch, and what I would encourage you to do is try not to get any gel either on the touch screen or on the main keyboards. So use your right hand or your left hand to perform the ultrasound scan, but try to keep one hand free to use on the keyboards so that you don't get any ultrasound gel on it, and that will minimize the risk of contamination. Around the touch screen we have a button there that allows you to look at patient data, a button there that allows you to change probes. This is the transverse gain controls, which allows you to increase or decrease the gain at different levels of the scan. Here we have a roller ball which moves the cursor around the screen, and the set button is just above and to the left of it, and that's the equivalent to the click button on a mouse. We then have print buttons, so if you want to print what is on the screen, and the printer is a black and white printer which is at the back of the machine here just underneath the storage tray, and in order to print the image you can press either this large button here to the left of the roller ball or this smaller button over to the right. If you want to store images, then you can still store here, so this is the button to press when you have just a frozen 2D image, and this is the button to press when you want to store a video clip. So we have buttons here for pulse wave Doppler, coloured Doppler imaging, and 2D, and both the gain, the 2D gain, can be increased or decreased using this button or this button around, or this wheel around the roller ball. And the freeze button is just here. Okay. Around the main keyboard we have the storage area for the probes, and you can see that there are 5 probes for use on the machine. For practical purposes and for cranial ultrasound scanning, we tend to use this probe here, which is a 7 MHz probe. But if there are babies whose fontanelles are quite small, then you might want to use this probe, which is even smaller. The others tend to be used for older children and abdominal ultrasound scanning. Underneath the main keyboard we have a typical QWERTY keyboard here, and you can move this underneath the main body of the machine once you've entered the patient details, and that means that it's kept nice and clean and the keys don't get filled up with dirt and dust. There's a little clip in the front of the keyboard just underneath it that releases it. Underneath the handle here there's another little clip that when you move it back releases the whole keyboard so that it can be moved to a place that's convenient for you to scan. And just underneath the left side here we have a lever, and if you press it up you can move and adjust the height of the ultrasound machine. Okay. Underneath the main body of the ultrasound machine you have active ports here on the right. So if the probes are in use and you want to record through them, then they'll need to be plugged in this part of the machine. But if you just want to store them while you're not using them, then this is a parking place to store the probe. When you want to move the machine, you can release the brake by pressing it back a little, and then that releases all of the casters, so they're all able to move freely. If you want to move the machine, the best way to do it is to depress the back of the foot pedal, and that locks the 2 front casters in the back and forth position and will not allow them to rotate. It will not lock the back casters, so you're still able to pull the machine from the back. The fact that the front ones are locked means that the machine does not swing around. If you want to lock all 4 casters so the machine is nice and stable for you to scan, then press the front of the foot pedal and that will lock all 4 casters. In order to perform an ultrasound scan you will need both your probe cover and some sterile aquasonic gel, and you are now ready to perform an ultrasound scan. To start, once you're ready and the machine is booted up, the next step when you're at the cot side is to dim the lights, because having a dimly lit room enables you to see the images a lot better. And of course we need to clean the ultrasound probe that we're going to use. So I'm going to unhook the probe and I'm going to wipe it thoroughly with the wipes that come with the machine at the back tray there. So I wipe the probe head and the lead that comes with it. And I'm going to open the sterile gel pack and that can be stored in there for now. Okay, so we've set the machine up now and we're ready to enter the patient details. So the machine will default to this screen and what it will ask you to do first is enter the patient ID. So we need the keyboard out, and I'll enter the ID like this, and you can either use the tab key or the roller ball with the set key to move on to the next box. So it's asking for the last name and the first name, the date of birth, and the gender. It'll also ask you, or you also have the opportunity to put in the operator ID. If your initials aren't there, then just type them in and the machine will remember them. And it'll also ask for the physician, in which case you can put the relevant consultant down. Now, if you need to do this in an emergency and you don't want to go through that process because it's a very urgent scan, then what you can do is press the emergency ID button on the screen, and that will give the baby an emergency ID number, and then you can start the scan virtually immediately. If the baby is already on the machine, what you can do is use the search function, and when you've put the details in, perhaps the ID number alone, and you press the search button, the patient's details should come up on the screen there, and then it's just a matter of double clicking on that patient, and that will allow you to open up a new exam for that patient. Okay, so I've inserted the details because our patient is not known to the machine yet, because he's not had a previous ultrasound scan. So I've entered his details and then press start. Okay, you'll also notice that on the touchscreen here you have 3 further presets, and you can use these if necessary. The settings as they are should be suitable for most babies, but you can further refine them by selecting one of these 3 options: term, preterm and extremely preterm, depending on the maturity of your baby. So for this baby we'll just choose the preterm settings. The final piece of typewriting that we'll need to do is to set the labels on the screen. So in order to do that, we press the ABC button, which is here on the left, and you'll notice that that has brought up a different set of options on the touch screen, as well as an orange cursor on the screen. We can move the cursor around to place our label, and then just press the label that we want. So I'm labeling the left side of the screen as the right side of the baby. I'll then move the cursor to the other side of the screen and press left. So that we have an appropriately labelled screen. Now, in order to know which side of the probe corresponds to those sides, you will notice that there is a marker on the screen here. So there is the sector of ultrasound imaging that is collected by the probe, which is represented up here on the screen. And you'll notice a marker there that is in the shape of a capital T. And that marker corresponds to this lump on the side of the probe. And you can see that there isn't a lump on the other side. So this lump corresponds to that marker. So this side of the probe will then be the right side of the patient, and this side of the probe will represent the left side of the patient. And therefore when you're ready to do your scan and you put the probe on the baby's fontanelle, it's important to get those sides correctly orientated. So the right side of the probe in this case is represented by this side of the probe. So this side will need to go on the baby's right side. Okay, so I've washed my hands, I'm going to put an apron on. And some gloves. I'm going to put some gel on the probe. Now put the probe cover on, and I'll need to put a little more gel on the top there. I then put my probe on the baby's fontanelle, and feel the baby's fontanelle here, and we'll just pop some gel on the fontanelle there. And I'm feeling for the marker on the probe. Of course, I put that on the right side of the baby. And that puts the image on the screen. Now, if we need to alter the image, so if we need to increase the gain, we can put the scroll. You can scroll up like that, or down, depending on how bright we want the image to be. So, gain up, or down, gain up, or down. And you can see the image on the screen, and it's important to get the midline down the middle of the screen there. So the first view that we take is a view through the frontal horns of the lateral ventricles. Now it's important that we fill the screen with the image, so that would be too small, and we change that by using the depth button on the right hand side of the keyboard here, and that would be too small. And that's about right. So we need a view through the frontal horns, and you can see the frontal horns of the lateral ventricles here. Try and get the image nice and symmetrical around the midline. When we're happy with the image, you can press freeze. If you press freeze but you'd like to go back a few frames, then you can still do that by scrolling backwards with the roller ball to choose the image which is best. Unfreeze that. Maybe it's moving around a little. And that's the image that we'd like from the frontal horn. So freeze, and then we store by pressing still store, and then you can print using the black and white button there. And as you can see, the printed image comes out from the printer. Okay, so that's the first view that we want. We then press unfreeze. Might need to alter the depth a little now to include the relevant images. So this is now a view through the anterior part of the choroid plexus, and you can see now the sylvian fissures are coming into view, as well as the temporal horns of the lateral ventricles. The third image is a view through the third ventricle, and you should be able to see that there's a little area of lucency there, which corresponds to the third ventricle. So that's the third image. And then we may need to alter the depth to include the cerebellum in this view. And the fourth view is the view through the quadrigeminal cisterns, just superior and anterior to the cerebellum. Next is a view through the trigones of the lateral ventricles, which is there. And the final view is through the substance of the brain, superior and posterior to the lateral ventricles. There. And for each of those views we press freeze and then black and white print. We then do so those were the coronal views. We then do the sagittal views. So we need now to delete. And you'll notice that I'm just using my left hand on the fingerboard, on the keys from now on, and keeping my right hand in the baby's incubator so that we minimize any contamination from the gel on the keyboard. So I'm going to go for the right lateral ventricle first. So this is the baby's right lateral ventricle, and it takes a little bit of practice to get the whole of the ventricle in on the same image, and there it is there. So we take that view and then we go lateral to the lateral ventricle so that it goes through the substance of the parietal and the temporal lobes of the brain. Then we move back to the midline view. And this time I'm going to change the label to midline using this shortcut, and you can see all the midline structures nicely illustrated there on the screen. And unfreeze and go for the left lateral ventricle. And again, try and get the whole of the lateral ventricle in. And I'm going to press left to label it. There. So I'm using the freeze and unfreeze function to get the best possible view. And then just go lateral to the lateral ventricle to get the substance of the brain lateral to the ventricle, and save and print. So I've now finished the scan. I've pressed the button with the two little figures in it, and I'm now ready to do the next scan. The machine will have saved those images, and in order to recall them, you can use your patient browser if you need to review them at any other time. The machine will keep the images for about 30 days, and then as long as the machine is connected to the hospital intranet or the hospital internet port in the parking space for the machine in the clean utility room, then the machine will then download those images onto the hospital server. So I've now finished my scan. I now need to clear up. So I'm going to put my probe there for a second, watching that I don't contaminate anything with gel. I'm going to wipe the little baby's head. Get the jelly off. Get rid of all of the rubbish. And now I'm going to wipe the probe with the cleaning wipes. These are called safety wipes. And please use these rather than tissues, because tissues are more abrasive and the probe life will be a lot longer if you use the safety wipes rather than the tissues. And that's it. To power down, you can now press that button, and depending on what you need to do next with the machine, you can either shut it out completely or put it into standby mode so that you can move it, disconnect it from the mains, move it to the next baby, and it'll take a slightly shorter time to boot up if you use the standby mode.